Now, as you guys can see, Danielle's just in a supine position, and I would like you guys to think about all the patients that we may work with in rehab who've had abdominal surgeries, neck problems. It's obvious that we could help people here with the shoulder, but I think sometimes we underutilize these patterns when we're working with neck patients or people who've had a hernia surgery, C-section, low back pain. So this is a very low-level position, but I don't just grab these bands and make people do exercises. I'm going to basically get Danielle with this stick in a comfortable leverage pattern, and I'm going to have you just hold that stick, and I'm going to try to pull it one way or push it the other way. Don't let me move. And just take note of the difficulty that you have when I pull and push. Good. Now we're going to change the position, and I'm going to go this way. Pull, push. You feel stronger on one side? You do. This side? Okay, good. We're going to go back here, and all I'm going to say is, would you bridge up for me? And we're going to challenge again. That better? Okay, what we just learned there is just by getting her glutes involved on this side, it feels more similar to the other side. She's already naturally stabilizing a little bit better here, not so much here. Now Danielle is completely aware of why we're doing the chop and lift and what it's supposed to deliver for us. So I could give her a band and we could start working right away. But in this mid-range, we're just really working with her strength. If I take her all the way to there and say, don't let me pull you out of there, that's that in-range stability. And a lot of times we fail to consider that. And to me, that's a much better signature of stability sometimes than that mid-range challenge. So I challenge her both ways. Now hold right here, don't let me take you out of there. Good. All right, bridge. Way better. It's that little bit of mushiness we feel on that end that indicates stability or not. And so now we've got a perfect paradigm to start showing her chops when she's exercising. So, and I want you to finish right about here. Don't wrap it around your body, but straight down and across right there. Good, and back. Now bridge and see if that's helpful.
Definitely.
Good. So what I'm going to have her do is unbridge. Okay, bridge first, set stability, go ahead and bridge. Now chop, now unchop, unbridge. So I went there from a challenge test of midline strength to a little activation technique that she has. Now, if she's a neck patient and I don't want her to say bridge up and flex her neck at all I do is put an AirX pad under her T-spine and she won't flex her neck as much. But the other thing I'm looking for is how much neck are you using here? We see a lot of people do chops and lifts and the minute they start, every neck muscle just bulges out. I tell them to bridge and relax their neck and all of a sudden they stabilize from the bottom up, not the top down. Now, we can also do a challenge with a lifting pattern the exact same way. So I'm going to have you lift here, okay? All right, knuckle to knuckle, right there. There you go. There you go. Now, and take it and press it out. That gets hard right there. See if a bridge helps that at all. And press it through. Good. So once again, we got a bit of a teaching moment here. And so instead of just assigning chops and lifts and walking away, I really like to do this challenge and help her see how maybe bridging. And then what I want you to do on one more chop here is do one pattern without a bridge. Go ahead and chop down and across. Good. And come back and now bridge. Come back. If it's more stable with a bridge, come back out of the bridge, but remember how you stabilized. And one of the ways I told her to do this is, listen, you're not just laying on your back. You've got some feet here. So stabilize from the feet up, but don't bridge this time and see if you get some of the same benefit. Yes. There you go. So I want you guys to use these challenges, not just to develop the obliques or the arms or something like that, but to truly help people appreciate a left-right asymmetry, and many times we'll see everything to the left, whether it's a chop or lift, is weak, or we'll find a single quadrant. And that's why I want you guys, when you look at this overhead, we've got this nice mat table. It really keeps us remembering these spiral and diagonal lines. I have a few pet peeves, and one is a flat chop or lift. It's when people want to do chops and lifts like this, it really doesn't fit the anatomical advantage we have. And one of the things we learn in PNF is the spiral and diagonal orientation of the muscles, the fascia, and the movement patterns do not fit straight plane movement at all. They fit these spiral and diagonal leverage advantages, and we want to exploit those when we're doing this.